Okay. So you know right away you want to see three first, right? What is the one word there that kind of tells you you need to go see this patient first? For choice three, very good, guys. So in choice three, sudden, and then what's the very good, sudden, and what's the other word? There's one word there, and there you go, acute. So, guys, pay attention to this question. This question will take you very far in your NCLEX preparation. Okay? Remember, um, somebody's name is Jean in the participants. Is this Jean Sant, the man, or is it Eve Rose Jean, the woman? Oh, okay, good. Oh, I've missed you guys. Okay. Well, you're always on. But okay. So, very good. This type of question is what I like. It's like a blueprint question where if you understand it, hold on one second, everyone. Okay, so this is a blueprint question that it's going to prepare you very well for the NCLEX because if you understand it, you can get a lot of questions correct on the NCLEX. So this is a situation where they want to know, can you figure out, you have to go see an acute situation first before you go see a chronic situation or a situation with a predictable outcome, right? Or you have to go see the unstable patient first and then you can go see the stable patient. So, for example, choice one, a client awaiting surgery for a hiatal hernia repair at 11 a.m. First of all, very rarely is a hiatal hernia deadly. So there's that. Number two, they have surgery scheduled at 11 a.m. So they have a problem and they have a solution of how they're going to go about trying to fix it, and it's scheduled. So, what's the problem, right? We're going to go assess them after we go assess the sick patient. A client with suspected gastric cancer who was on NPO status for tests. So they're NPO and we're running tests. What is the problem? There's nothing that's sticking out that's saying like I need to go see them first so they don't die, right? Four, a client who is requesting pain medication 2 days after surgery to repair a fractured jaw. So what sticks out to me here is that it says 2 days, right? So this is setting a timeline. So when we're talking about 2 days versus sudden and acute, you will see which one is more important, right? So that's why three is definitely who you would go see first, right? Exactly. So a client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. So what could have happened? What do you think could have happened that they have an ulcer, right? And now they have sudden stomach pain. What do you think could have happened? Perforation. Very, very good. Okay, perforation. You know what? So Miss Francina asked if we could go over case studies. I think that would be a wonderful idea. So we will do that next class. Okay. So we're going to have class on Friday as usual. I know it's going to be the 26th, but we're going to have class as usual on Friday. So yes, we will do some case studies. And I haven't forgotten that somebody asked for dosage calculation, and we said we would do that for the last class. Okay. So very, very good. All right, let's do some more questions and then jump back into lecture. So 13, and the nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed assistive personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously afebrile, has developed a temperature of 101.8, 38.8 degrees Celsius. What should the nurse do in response to this reported assessment data? Okay, so go ahead and read the choices and tell me what you would choose if this was the NCLEX. Very, very good. The correct answer is 1. So we want to assess the client for potential perforation. So how would you go about assessing? You would take the vital signs and look at the heart rate and the blood pressure. Okay, and also, look in the patient because it was an upper GI endoscopy, so they went in through the mouth. So look and see if they have any hematoemesis, if they have blood coming out of their mouth. Okay, and then also, I know we talked about hematoemesis, which is when we vomit blood. I also want you to know about hemoptysis, and the spelling this is crazy, but coughing up blood. Okay, so that could also be a sign, when something is perforated, blood vessels are punctured, and that leads to some type of bleeding. So the bleeding can remain internal, and we not know that they have an upper GI bleed until they have like the dark tarry stools, right? The melena. However, they can cough up blood. So that would be hemoptysis on the NCLEX. If they're vomited, that would be hematoemesis. So we would assess the client for potential perforation. All right, let's do one more question and then we will go back to 15. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. Okay, so the correct answers for 15 are 3, 4, and 5. So, vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools from gastric bleeding. Clients with gastric ulcers are more likely to have a burning epigastric pain that occurs about an hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during night and is frequently relieved by eating. All right, so let's go back to the study guide. All right, so now we're going to jump into cholecystitis, which is dealing with the gallbladder. So we've learned a lot about the stomach. We learned about GERD, gastritis, and peptic ulcer disease. So now we're going to switch organs and go to the gallbladder. So cholecystitis is an inflammation of the gallbladder that may occur as an acute or chronic process. It is usually associated with gallstones, which is called cholelithiasis. Okay, so cholecystitis is inflammation of the gallbladder, and it's usually caused by the presence of cholelithiasis, which is gallstones. So anytime you see the words lith, that means stone. Okay, so clinical manifestations, indigestion, burping, passing gas, epigastric pain that radiates to the shoulder or scapula, 2 to 4 hours after eating fatty foods, right upper quadrant pain because the gallbladder is in the right upper quadrant, rebound tenderness, Murphy's sign, elevated temperature, tachycardia, dehydration. So Murphy's sign, the client can't take a deep breath when you press on the right upper quadrant because of the pain. So, surgical interventions, the most common is a cholecystectomy, which is a removal of the gallbladder. Okay, so nursing considerations, interventions post-op. So these are the common post-op procedures we use to prevent post-op pneumonia, early ambulation, deep coughing and breathing, and symptom spirometer, splinting, preventing DVT, early ambulation, TEDS or SCDs. So this is basically very familiar to you. However, just know the terms like cholecystitis, cholelithiasis, and cholecystectomy. So cholecystitis is the inflammation of the gallbladder. Cholelithiasis are gallstones, which is what often causes it. And then cholecystectomy is when we remove the gallbladder. Next up is pancreatitis. Pancreatitis is an acute or chronic inflammation of the pancreas with associated escape of pancreatic enzymes into the surrounding tissues. So, just for homework, read through the manifestations of acute versus chronic pancreatitis. Okay. I want you to know gray Turners and Cullens. So gray Turners is a bluish color of the flanks. Cullen sign is a discoloration of the umbilicus. So I want you to know that gray Turner sign and Cullen sign indicate pancreatitis. So let's look at a picture. So here is an example of a healthy pancreas, and we have a healthy pancreatic duct. Okay, and here we have pancreatitis, where we have an inflammation of the pancreas, and it is being caused by a gallstone being stuck in the bile duct. So the bile ducts being obstructed by gallstones are one of the most common causes of pancreatitis because now the pancreatic enzymes cannot be released into the duodenum. And so this buildup of the enzymes and this blockage, this obstruction because of the gallstones is what can lead to pancreatitis. And one of the manifestations would be Gray Turner's sign and Cullen's. So Gray Turner's is a bluish discoloration of the flanks. And so this is on your side, right? So the way you can remember that Gray Turner's is on your side is that the patient would have to turn to see it for themselves. So Gray Turner's, they would have to turn to see that the discoloration is on their flanks. Cullen's is a discoloration of the peri-umbilical area around the belly button. So I think Cullen's cute because the belly button often looks cute. Okay, so Gray Turner's and Cullen signs both indicate pancreatitis. So another important thing I would know for NCLEX is for chronic pancreatitis, we don't give morphine. That would make the pain worse. So for homework, please review pancreatitis. You have it in your study guide. It's here for you. And so that is on page 226. Next up, we're going to talk about ulcerative colitis. So ulcerative colitis, very important. And so we're going to learn the difference between ulcerative colitis and Crohn's disease, okay? However, let me backtrack a little bit. There was two more pictures I wanted to show you. So here's a gallbladder, and we have the gallstones, cholelithiasis. And as we can see, these stones can block ducts. And when they block ducts, enzymes cannot get into the duodenum the way they should. And so the enzymes back up and cause inflammation and other issues. And so one of the major causes of gallstones is, diets that are high in fat, fried, greasy foods. So this is another example of how gallstones can block the common bile duct and can obstruct the pancreatic duct. And so again, the pancreas is trying to release enzymes into the duodenum, but it can't because of these gallstones. And the gallbladder is trying to release bile into the duodenum, but can't because of these gallstones. So this is what are going to lead to very uncomfortable GI symptoms for the patient and possible right upper quadrant pain and discomfort as the gallbladder would become inflamed, or it can lead to epigastric discomfort because the pancreas, you can see the tail of the pancreas behind the stomach. So if we're looking at the regions, this would be in the epigastric area. This can cause, if it caused pancreatitis, or in the right upper quadrant of the patient. Next up, we're going to talk about the differences between colitis, ulcerative colitis, and Crohn's disease. And I know we're kind of zooming through this, and my goal here is to not shove everything down your throat. My goal is to explain the diseases and treatments in a way that you're going to remember it and understand it so that you can apply it to questions when you see them on the NCLEX. So the goal here is to not finish quickly. I value quality. So that's why I'm taking my time to explain these. So colitis versus Crohn's disease. So what is the difference? Ulcerative colitis, the name says it, colitis, it only happens in the colon. Okay? Ulcerative colitis only affects the colon because it says colitis. Crohn's disease can happen anywhere in the GI tract. And remember, the GI tract is from the mouth to the anus, right? And so Crohn's disease can happen in the small intestine, in the large intestine, okay? Another major difference is that colitis, ulcerative colitis, is continuous. So it affects a continuous segment. Crohn's disease can happen in patches. Okay. So the difference is ulcerative colitis affects the colon. Crohn's disease can happen anywhere from the mouth to the anus. Ulcerative colitis is a continuous inflammation of the colon. Crohn's disease, you have healthy parts of the intestine mixed in between inflamed areas. Another major difference is that ulcerative colitis only affects the innermost lining of the colon, whereas Crohn's disease can occur in all areas of the bowel walls. So for homework, please review ulcerative colitis and review Crohn's disease. Okay, so we're going to stop there for today. And I know that it seems a little bit unfair, that why are we going so slow? And again, I don't want to overwhelm you, okay? So let's do a couple of questions on pancreatitis, and then we'll talk about your homework. You know what? We'll do 3 questions on pancreatitis, and we'll do 3 questions on cholecystitis. Okay, hold on. And some of these are going to be learning questions where we're going to learn something through the question. All right, 17. The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that. What would you choose if this was the NCLEX? Very good. The correct answer for 17 is choice 1. So there is a strong link between alcohol use and acute pancreatitis. Most often, patients who abuse alcohol are more at risk for pancreatitis. All right, we're going to go to question 19. A client with acute pancreatitis has a blood pressure of 88 over 40, heart rate of 128, respirations of 28, and Gray Turner sign. Which action should the nurse perform first? We're on question 19. So this is a tricky one. The correct answer is 2. So you would want to place an IV line in first. So why? Because the blood pressure is low and the heart rate is high. So the blood pressure is low because acute pancreatitis can lead to shock, like the symptoms of shock and sepsis. And so if we put the IV line in, we can begin to give IV fluids, which would increase the blood pressure and help to decrease the heart rate. The heart rate is so high because the blood pressure is low, and the blood pressure is low because the patient is going through a state of shock because of the pancreatitis, and it causes vasodilation. So we need to increase the fluid volume that will increase the blood pressure and normalize the heart rate. Now, with the respirations of 28, it's probably because they're in pain, not because they need oxygen. If they needed oxygen, they would put the O2 saturation was low, but they didn't, right? So it's because the patient is in pain. Pancreatitis is extremely, extremely painful. Okay, one more question for pancreatitis, and then we are going to go to cholecystitis. All right. 21. Which of the following medications would the nurse question for a client with acute pancreatitis? Very good, morphine. Remember, morphine would make the pain worse, okay, for acute pancreatitis. It's going to affect the sphincter, one of the sphincters associated with the pancreas, and it would make the pain worse. So we do not give morphine for acute pancreatitis. All right, let's switch gears to cholecystitis. Okay, question 1. A client has undergone laparoscopic cholecystectomy. Which of the following instructions should the nurse include in the discharge teaching? The correct answer for 1, very good, is 4. Report any bile-colored drainage from any incision. So a laparoscopic cholecystectomy is when they use little cuts on the abdomen, and they insert the tools in the camera inside the body, and then they use it to remove the gallbladder. So they're not making an incision and then opening up the patient and removing it. They're using little cuts and the camera to do that. And so if there was bile coming from the incisions, that could mean that the suture sites have been disrupted. Okay, a disruption of the suture sites. So you would want to report that to the healthcare provider. Question number 2. A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions. So read the choices and what would you choose if this was the NCLEX? Which one would you question? Very good too. And so this is a learning question. I know that we said no morphine for acute pancreatitis, but also morphine for cholecystitis of the gallbladder. It can also lead to spasms, and so we would not want that. Meperidine would be better, okay, which is also called Demerol. Okay, meperidine would be more ideal. All right, one more question, guys, and then we are going to end the session. We're going to do number 9. All right. The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 98.6, BP 118 over 76, respiratory rate 16, and heart rate 78, but are now changing. Which of the following indicates that the nurse should contact the physician? Very good. The correct answer for 9 is number 1. So because yes, because it has more things wrong with it. The temperature is too high and the respiratory rate is too high. Okay, and maybe the blood pressure is high because of the pain. However, everything else, like 2, everything is pretty much normal. 3, like the heart rate is just like 58. And then 4, everything's normal. So 1, you have the high temperature and the tachypnea. So that's why you would report that. So everyone, your homework is to review this recording and to study the disorders and procedures that we've learned. So we will be having class this coming Friday starting at 10 a.m. So we will be finishing up GI and talking about the most important disease, which is cirrhosis. All right, everyone. God bless you. Thank you so much. And I will see you on Friday. Merry Christmas and God bless you.